Good morning, everybody. My name is Samantha Weston. I am the Senior Programme Manager for the SPARC programme. I'd very much like to welcome you to our event this morning. Thank you so much for joining us. I'm just watching everybody dropping into the waiting room and joining us. It's quite a crowd that we've drawn this morning. I'd like to begin by reminding people, please do throw in questions to the chat box. We will try and address those as the programme goes through for this morning. And we will also try and save a little bit of time towards the end of the session for people to ask questions live and for us to hopefully be able to answer them live as well. I'm going to start with handing you over now to Victoria Rutter, who is the Chief Executive Officer for the Commonwealth Pharmacists Association, to say a few words of welcome. Over to you, please, Vic.
Oh, thank you, Sam. Just a quick reminder to please mute yourself as you join so that we can all hear it. I don't know if Bridget, can you just don't mute me there. Okay. Thank you, Sam, for that introduction. And good morning, good afternoon, good evening from wherever you're joining us from around the globe. It's a very exciting day today, and I'd like to congratulate the team on getting this far. It's really been quite a tremendous effort to get to this point. So thank you to everyone and to all of you joining us that have been part of this. Thank you for helping us celebrate, because I think it is something to celebrate today, where the Prescribing companion app goes live. So first of all, I'd like to welcome you, our attendees, ministers, director generals, Fleming Fund colleagues, DHSC attendees, CPA trustees and councillors, CPA consultants, partner organisations, and all healthcare practitioners and friends. We're delighted to have your attendance today and officially launch this Prescribing companion app. The app's been designed specifically to increase accessibility to high quality antimicrobial prescribing guidelines across 22 Fleming Fund countries. And the app was developed as a specific output from the surveillance and prescribing support for antimicrobial stewardship resource capacity building programme, which we named SPARC because we think that's much easier to say. It's been funded by the UK Department of Health and Social Care's Fleming Fund, a UK aid programme supporting up to 25 countries across Africa and Asia to tackle antimicrobial resistance. And as many of you already know, the CPAs work closely with support from governments across the globe to support the digitisation and upload of each country's individual approved antimicrobial guidelines, and providing an offline available app platform free of charge to support the increased availability of antimicrobial guidance for frontline prescribers. We've got a short presentation to follow to explain the app further, and we'd like to encourage you to drop questions in the chat box also at the end of the session, and we'll get around to answering those. But let me give you a brief introduction to the CPA and who we are. You can see our host today there, and this is just a run through of how the day is going to go. You can see on screen, which I'll leave Sam to explain a bit later. Could you move to the next slide, please? It's just a brief overview of who we are. Could we go back to the slide before, please? Okay. So just a brief overview of who we are. We are a charity that was set up in the 1970s by the Royal Pharmaceutical Society, and we became independent of them in 2015, and we've developed our work streams quite exponentially since becoming an independent organisation. And we were set up to support the development of the pharmacy workforce across the Commonwealth, and to leverage the strengths from all different Commonwealth countries. Our work really helps to improve access and use of medicines for the benefit of the people of the Commonwealth and beyond now, I have to say. Next slide, please. Our vision is to lead and develop the pharmacy profession across the Commonwealth. And if any of you know, the Commonwealth is now formed of 56 independent states. It's a third of the world population, and many of the countries that are part of the Commonwealth are lower middle income countries, many small island states. And we work together with them to try and help improve access to medicines through various different routes, and also the use of medicines through the development of the pharmacy workforce. Next slide, please. So we've got access to about over 1 million pharmacists globally, and we work across all Commonwealth countries and beyond now, as I said, through our SPARC programme in many other lower resource settings to develop the pharmacy workforce, strengthen healthcare systems and advocate for improved access and quality of medicines. Next slide, please. We do this in a variety of ways, and as you can see here in the middle, we're the Commonwealth Pharmacists Association. This is where we're placed within the Commonwealth. We're an accredited organisation of the Commonwealth. We work with national pharmacy associations and other NGOs that are affiliated to the Commonwealth, and we have advocacy routes in to the health ministers and the now 56 heads of state through various different forums and committees. And that's how we can also, at the same time as deliver these programs, help to advocate for improved use of medicines, access to medicines and development of the pharmacy workforce. Next slide, please. Here are some of, three core areas of work and some of our programs that you can see listed on the screen here. So we do many different things, but one of our big programs and areas of focus over the last sort of 3 to 4 years has been antimicrobial resistance. We know that it's a huge global health threat, and it disproportionately affects low middle income countries. And so this has been a really big area of our work through our Commonwealth Partnerships for Antimicrobial Stewardship programme. And then SPARC was a spin-off of this from last year. So I'm going to hand over to Sam now, who's going to explain a little bit more about the SPARC programme and talk more about the app launch. So Sam, over to you.
Thanks very much, Vicky. I hope that helps put us into perspective for those of you who haven't met us before, and just refreshed the memories of those of you who already know who we are. So, as you know, SPARC, with its very lengthy title, Surveillance and Prescribing Support for Antimicrobial Resistance Resource Capacity Building. This is a project that started in January 2022 and was originally scheduled to be terminated at the end of September. Terminated is a very final word. Come to an end at the end of September 2022. And we recently worked with the fund holders to extend the contract up until March 2023, because we have made such great progress through the first 9 months that we have managed to continue that for a little bit further on. Moving on to the next slide, please. A little bit about SPARC. We have 2 main work streams for the SPARC programme. We've got the Prescribing Companion, which you know a large amount about and will know even more about by the end of today's meeting, and Workstream 2, which focused on the delivery of training for global PPS and also the development of a continuing quality improvement work stream and work culture in a number of countries. So the Prescribing Companion, as we've mentioned before, covers up to 25 countries, 22 to start with, and the PPS work with the AMU surveillance, etc., and the CQI training was focused on 6 of those 22 countries to start with. So moving on to the next slide, tell you a little bit more detail. So the work that we did for the PPS, I'm going to just touch on very briefly, but I'm going to allow Max to tell a little bit more detail about that one. So if I hand over to you at this point there, Max.
Thank you very much, Sam. And more about the point prevalence survey and the CQI project under the SPARC program. I'll begin with the benefits of conducting the PPS and CQI, where we're engaging our 6 countries. As you may see in the left-hand corner, the 6 countries we've been working with. The benefits we've realized in doing this include highlighting the importance of MR and MS to the various stakeholders we've been engaging, and how we can use PPS and CQI as tools to address MS and MR. And also we've seen a benefit around data generation for MS and analysis, and how this data, we believe this data can be very helpful in informing national action plan outputs, but also facilitating evidence-based interventions. And through the process of conducting PPS and CQI, we've seen an opportunity of strengthening knowledge, capacity, and resilience of health workforce, and also a platform for building a network for behavioral change at local level, national level, and also regional level. as well as creating a platform for shared and sustained learning by the communities of practice platforms that we've set up. If we can go to the next slide, I'll take us through the process of rolling out PPS, what we went on as we're planning the rollout. Key to note is being the central engagement of our stakeholders. And this ranged from when we identify the 6 countries to work with, and as well as engaging local stakeholders for us to understand the context of these 6 countries. And in each of these 6 countries, we worked with the stakeholders to identify the suitable sites according to the criteria that we had, which criteria was that in each of the hospital sites, we should have inpatient beds, and we should also have PPS not being conducted in the past 9 months. If we can all mute, I think that would be helpful. Thank you very much. Then as part of step number 4, it is to show us that in creation of some of these resources, we've been having a central engagement of expertise and also in-country stakeholders. And that's the road that has led us to training the Saint champions from across the 6 countries, and also the road that has led us to point number 6, where we see ourselves rolling out the PPS and CQI in each of these sites. And the essence of this is to see that our PPS and CQI components of work is fully owned and led by in-country champions to foster the antimicrobial usage practices in country. If we can go to the next slide, please. Yes, this is just a photography showcasing some of the in-person trainings that we've been conducting across the countries. Specifically in the image here, we see the training we conducted around July this year with the Nepal team, empowering them on how to use the PPS data collection tools and how they can use the behavior change tools to foster change following the data that they have obtained in the PPS. The next slide, please. Yes, a similar photo, but this was taken from Uganda, where we gathered a group of 4 country state champions who came to Uganda also for similar training in PPS and CQI. And very interesting to note that over the 30 attendants who attended in Uganda back then in April, many of them, if not all, took pledges also for antimicrobial stewardship practices that they can do on personal or institutional level. It's the photo we can see on the left-hand corner. Each one of us are raising up the pledges that we've undertaken. If we can go to the next slide, please. All right, and now this takes us to some of the impacts so far that we've achieved conducting the PPS across our 6 countries. We've trained and empowered 30 site champions to conduct this PPS at their hospitals by themselves. And we've engaged additionally 82 data collectors so far to support the conduction of the PPS, and also it's been an opportunity for them to get empowered on how to do the PPS and perhaps analyze the data that they have collected. And it's important to note that across the 6 countries under which we've worked, we've had engagement of, in total, over 10,700 inpatient beds hospitals. And we've also had over 10,000 staff across the PPS sites. And the coverage of these sites in total, they cover over 12 million patients and in service. So we believe our impact will spread across all that. You can go to the next slide, please. And now this is specific to the impacts so far in terms of CQI, continuous quality improvement. We've had in-person trainings conducted in Nepal and Uganda, like just seen in the photos. And we've also additionally been conducting online learning sets where we bring our site champions to share their different work plans as they have developed and also keep learning from each other. And we've established a community of practice via Facebook where our site champions get to share the lessons and the progress, and in that way they keep learning from each other. And very importantly, we've had an opportunity for co-developing a CQI template, continuous quality improvement template, that can support the in-country teams to develop behavioral change actions and plans following the data that they have received from their PPS. And at this point, I'm happy to say that we have had MS action plans created so far across 3 countries in 15 hospitals. The countries we see in the right-hand corner, Malawi and Nigeria and Zimbabwe, and yet more countries are yet to produce their action MS plans as we do continue. The next slide, please. All right. Yeah, this is now the next steps regarding PPS in the countries where we are working. We are continuing with the training and rollout in countries like Timor-Leste for 2023, and continue to offer continuous support for behavioral change once sites request for that from the technical side of CPA. And also we continue to build on our established platform for community of practice, so that continuous learning doesn't end when the project or program ends, but it can continue on and on. And in a vision that we can have SPARC 2, we shall do the scoping for SPARC 2 to see further needs and for implementation of the PPS. And with that, I think I hand over to Bridget to tell us more about the reason for today's Prescribing companion app. Thank you very much.
Thank you so much, Max. I shall now take you through the other work stream, which is the Prescribing companion app, the reason why we are here. So the app is simply a repository of prescribing resources for both human and animal health that has been designed to drive better use of antimicrobials. With that, we designed the app to help avail guidelines and standard treatment guidelines offline at point of care. We believe that this is important, having those guidelines without need to connect on the internet, especially the low-middle income context. So once you have the app and you've downloaded the guidelines, you can freely access them offline. The app being is a one-stop center for international AMS and IPC resources. So with these under one platform, we hope to raise awareness and of services to the healthcare practitioners who use the app. We've also designed the app so that it is very customizable. So right now, the scope of SPARC is to focus on antimicrobial use. However, going forward, together with the app champions who are super users and have been trained to do so, the app can be adapted, and therefore we hope to have strong country ownership where countries can add guidelines to what suits their context. Probably this is the first time we have the guidelines of human and animal health on one platform, and we want to foster a One Health approach and have shared learning. Through the SPARC program, we realized that some countries have gone further to develop guidelines, for example, in animal health, and others are just in the process of starting. And so having a platform where you can access any country's guidelines, of course, with the right permissions, then we hope that those discussions can start and there can be that shared learning. As Sam mentioned earlier, this is a project that is going to continue for the next 5 years. The app will have a running license until 2027. Through this period, there will be continued training for the app champions to manage and add new content, add the most up-to-date content onto the app. And the training will also continue in the rollout into the country-specific structures. With that said, at this point, the app is currently live across 13 of these countries on the screen. And as the program continues until March 2022, we'll continue to roll out to other other countries in the rest of the 22 cohort that we've set out to have the app available. So I'll take you briefly through the roadmap of how we develop the app. And important to note, as Max mentioned, we have worked with stakeholders in the Africa and Southeast Asia region to have guidelines identified in the first place for these countries that we are going to support. And then through the stakeholder engagements, we are made aware of what are the most up-to-date guidelines. We started the discussions on what does the approval process look like to have guidelines on a globally available app. And then moving forward, we uploaded the guidelines, went into the collation of these vast international resources out there so that they are relevant and make sense, and then upload them on the app developer, the TACTM, who have been so essential in this process. And then once the guidelines were on the app, which exactly mirrors the website, they went through a thorough governance check where we engaged a range of technical officers, pharmacists, to check and make sure that these guidelines are accurate and relevant. And this was overseen by our AMR lead on the CPA team. In the recent times, we've now gone forward to engage the app champions who are against the super users in country. Each country has an app champion, and these champions have been trained to fully customize and edit the app, maintain it, make sure it's for country context. And this training and support will be available for the next 5 years so that, again, the app can be owned by these countries. It's your app, not our app. So that ownership is very important to us. And right now where we are is the go live stage, whereby the app is now fully available on the Google Play Store for download. It's available on the Apple iOS, and there is also a website. And right now we are also looking into the final approvals in country to have these national guidelines that we've uploaded onto the app go live, so that healthcare practitioners can access this and use them. And right now, as I speak, we are at the final stage, which is the launch of the Prescribing Companion app. So since go live, the SPARC program has had a huge impact. As mentioned, we've had and trained 13 app champions in each country. They've gone through a 5-hour training, and this training is going to continue over the next, the training and support will continue over the next 5 years. They've gone through the live didactic sessions, which have been handled by the content managers at the TACTM, who are our app developers. They also continue with the practical sessions where they have practical toolkits. They continue to practice and add content and see how that editing can be done so that the app is very relevant and has the most up-to-date information. As I speak right now, there are 10 national guidelines on the app, 7 human health guidelines from Tanzania, Zambia, Malawi, Nigeria, Zimbabwe, and Ghana. We have 3 national animal health guidelines from Uganda, Bhutan, and Bangladesh on the app. So I'll hand over to my colleague, Meghna, who will take us through the next part of the presentation.
Thank you, Bree. As before we go into the main part of demoing the app, which I'm sure everybody's quite excited to see, we just wanted to reach out to you about some of the reach of the app. So as Max talked about the impact of what the PPI and CQI work has done, we've looked a little bit around the reach that the app has. And this slide presents the number of people that the app, where it is currently in use or being launched as of today. Say, for example, in Malawi, in Kenya, our app champions are working hard at raising awareness of the app within their hospitals. And then wider, we have reached out to ministries in, for example, Bhutan, Nigeria, Sierra Leone, where we are working closely with them in raising awareness of the app. the core goal of this is to make sure that the guidelines are on there and that we are able to ensure that they're available at the point of need, at the point of care. So as mentioned in the chat, and we're very happy to take questions and things later on, part of our process has been around getting approvals to put the guidelines on the app. So if you are interested in using the app or having your guidelines put on there post this launch and you don't see your country on there, please do reach out to us. We have a robust process and approvals that we can reach out to the ministries or the relevant hospitals and see how we can look at working with you to get the app up and running. So now I'll pass you on to both Tactum, our app developer, and back to Bree, who will present the app to you and do a live demo. Thank you.
Hi, my name is Neil Francoeur, and I'm just briefly just going to talk a little bit about Tactum. Our focus is healthcare. That's pretty much all we do, and so this was a great project. We feel very fortunate to be part of this project, and it's really exciting to see everything summarized today. The platform that the app is on is called Curus, which we it's not the only use. We've used it in a number of different countries, and it's a very robust platform and is well in 100,000 accesses every day. We've done similar projects in both Scotland and in the United States, doing exactly just this, antimicrobial stewardship. For those that are concerned about security, that is a very big part of our business, making sure that what we're doing in healthcare stays secure. And so we have attained the ISO 27001 security. And we are actively involved with Microsoft and kind of keeping us current. And so that's just really, really quickly high level about what Tactum is. And I think probably at some point about probably 40 or 50% of our entire team has been involved in this project. And so we're really excited about what's going on here. I'll pass it back now.
Thank you so much, Neil. So with that said, I'll just quickly take you through a short demo of what our app looks like. So as you know, there is an app and a website. So today I'm presenting that it exactly mirrors and it has the same function. So when you download the app or at the website, at the landing page, you'll see a number of tools, and these are represented in country-specific toolkits. So here you can see the range of countries, up to 22 countries. However, as mentioned, we are live so far in 13 of these countries. So if you look at any of these toolkits, when you have the app, you can download, so for example, the Kenya toolkit from any part of the world, and once it's downloaded, it can be available together with all its content offline for use. So for the case of this demonstration, I will use the Uganda toolkit and show you a deep dive of how we present our content. So once you go into each toolkit, you'll see the guidelines and resources presented in these 6 notes. So for example, you'll find the infection and infections prescribing. This is where the standard treatment guidelines sit. And if I go into a step deeper into the Uganda guidelines, you'll see they have the 2016 guidelines. However, we have news, for example, that they are currently reviewing their guidelines. And that's where the app champion comes in. When the guidelines are ready, they'll then work with us together with the app developer to have the guidelines uploaded. So this will usually be similar or is similar to the guidelines in your country. And if you want to treat pneumonia and you're a health worker at the ward, you'll just simply go into the body system of that specific disease. You click respiration for a pneumonia, go into pneumonia, and then you can navigate and see the treatment options. Here in the Uganda guidelines, they classify them according to the age group of the patient. So you select if it's up to 2 months infant, you will see the range of treatment options available. So having this easy access to the most up-to-date guidelines for for your individual country will improve the prescribing practices of healthcare practitioners. And this, you can follow the same procedure to access any other resources and guidelines through the body system structure. So I'll just go to the next node, which is the other common clinical conditions. As we've mentioned, we've designed the app so that it's very customizable for individual countries. And right now, the scope of SPARC is around antimicrobial stewardship and microbial use. But as we engage with the stakeholders, they say they want a very usable app. And that is obviously going to be beyond AMU to expression medicine use. So in this node here, you can add any other guidelines. For example, if you have guidelines on hypertension, and we train the app champions to be able to go to the back end and add more information as the country pleases. So here, the International Antimicrobial Stewardship and IPC is the toolkit that has the core module that I was referring to. So you'll see a range of international resources that are available out there, but with the app, you'll have them in one place. So for example, you'll find resources around the WHO essential list of anti-infectives. You find some IPC, some stewardship tools, some antimicrobial use surveillance tools. Earlier, you've heard about the PPS, the global PPS, the WHO PPS. So healthcare practitioners can get acquainted with these resources, and that's the knowledge and awareness that we want to raise for our end users. So in this same node, you can find international resources for animal health. So at the moment, we have some resources from FAO. We have a knowledge hub for vets where they can go on and learn a range of resources out there that are available, and a number of other resource documents. This remains a work in progress, and as mentioned earlier, we're looking at expanding this work, and this is a very interesting area that we want to continue and capacitate our stakeholders and country teams. So in this, the international AMS and IPC resource, you'll still find some resources from the CPA that has been big around the AMS space. So you'll find reference and links to the AMS game, our famous CPD platform. You'll find a number of IPC toolkits. So again, as a repository or one-stop resource, the app hosts all this under one place. So still in the international AMS, you'll find COVID-19 resources. So these are resources from WHO, FIP, Africa CDC, and the like. So these are resources that are internationally available. But if I go a step back, just to show you the country-specific information. Hold on one step. Back to the Uganda toolkit. And we are out of the international AMS and IPC node. You'll see that when you go to the country-specific COVID-19 section, for example, you'll see that you have the international COVID-19 guidelines, which will revert you back to the shared international AMS resource. However, now this will lead you to the Uganda specific guidelines, and usually this will be a portal to the Ministry of Health site or authorities that are in charge of such guidelines. In the same way, when you go to the animal health node, for countries where they have national animal health guidelines, you'll find a list there in Uganda that have done some good work around these, the different sectors. You can see some resources from fish farming, cat farming. And so for countries which have not done anything, this is a very useful resource even to start a discussion in starting to develop their own guidelines and have reference to to what is already available. So the last area that I would like to talk about is the intervention recording section. And this is an area where the app can be used to collect data. So you can add, it's also a very customizable area. You can add audit forms, you can add surveys. So at this point, the SPARC program has added what we're calling the intervention recording form. It's just a short form which will collect data on what the app is being used for. So for example, if you went to the app and checked a dosage, then you would fill in this form, and then from our end, it just informs us what the app is being used for, and it will help us in further developing the app so that it's very relevant for the end users. Yes, so that's the main content of the app. I'll just show you our different toolkit. Just is the same layout in each country. So for where the countries have country-specific information, it will be my own data sections in the country toolkit. And then outside the toolkit, you'll find some information around the frequently asked questions. So if you have any questions about the development, what the app is about, and more on the content and guidelines, you can find it in our FAQs. And then there's a contact bit. If you have any questions, technical queries, there are emails and contact information available for you to reach out to us. So I'll just stop there. Hope you appreciate the app, and thank you for taking the time.
Thank you very much, Bree. That was really, really helpful. I hope everybody has a better understanding now of how the app actually works. It's been a labor of love, as you can probably tell, one that we've really, really had a great team working on together. My slide here is to tell you a little bit more about what's happening in SPARC. I'm sure those of you who with very sharp ears will have heard Max giving a teaser about SPARC 2 earlier on in the presentation. And we are starting our scoping in the next month or so about what aspects of the current SPARC program could be developed moving forward into the future. And I'm hoping that maybe some of you guys can throw some ideas into the chat as well of things that you would like to see moving forward as well, so that we can start working. We've been in early discussions with the fund holders as well, so we're getting some guidance there. And there's a fair amount of creative thinking going on, as you can probably imagine. As I touched on earlier, we've been lucky enough to have our programme of work extended to March 2023, and that's to ensure that we can continue to build on the excellent delivery models that we've had already of our teaching. We showed you some of the teaching in Nepal, and earlier in the 2022, we also delivered in Uganda, and we brought together countries, Zambia and Eswatini and Kenya and Nigeria as well. And it was lovely to have a really large group of people together, as I'm sure a lot of you would be aware. The opportunities for gathering people together for learning and sharing opportunities have been very restricted due to COVID. So it was a great experience for us at the CPA to be able to facilitate that again. And incredibly grateful to colleagues in those countries for being able to make the time to take the journeys, which weren't easy, as we all know, but to gather everybody together again. Based on that, we've extended our delivery materials now, and we're intending to move to Timor-Leste in early February 2023, to deliver a similar training program of PPS and CQI on the ground in Timor-Leste, and we're beginning the plans for that at the moment, which is very exciting, as you can imagine. We're also working to continue this blended delivery model. So we do go into countries to deliver, but we also work very hard with technology in order to make sure that we are reaching people that aren't necessarily able to make those journeys or to get time off work to be able to come. We're conscious that we're working with people with a variety of resources available to them. So we are intending to continue to come up with alternative models as the needs are required. And we're delighted that we're able to start doing that a little bit more. As you know, the internet is not our friend in many countries, and I include the UK in that. My colleagues will tell you that I am often unable to share my video, like today, because of my internet access. So yes, there are some challenges all over the world when it comes to internet access. So in-person delivery is as important as blended delivery and online delivery as well. We are intending to continue and expand the collaboration with countries. As you touched on, Bree, we have 13 countries with app champions in place at the moment, and we intend to continue searching for colleagues to represent other countries as we move forward and develop those relationships over the next generation of SPARC as well. Moving on to scoping for SPARC 2, we're certainly looking at delivering in local languages. So the Timor-Leste delivery will also involve some teaching in Tetuan, which is the local language there. We're also looking at supporting potentially human health guideline development and revision, potentially animal health guideline development and revision as well. Bree certainly highlighted the challenges we've come across with accessing and finding good quality animal health guidelines. It's been a real privilege to work with a lot of our veterinary colleagues, and we've got some real passionate people, advocates for the One Health approach and for animal health guidelines. So we are finding those resources, and we're intending to try and make those appropriately accessible for other people with the correct processes of permissions that Meghna touched on during her presentations as well. We're certainly looking as well at the environmental standards and guidelines, the early days for us, but also trying to align the whole work that we're pulling together with the One Health principles. I think that touches on where we're up to with what we're hoping to deliver next in SPARC. So that's up until March 2023, and then moving forward into SPARC 2 over time. But at this point, I'd like to open the floor up and see if anybody has any questions for us before I invite our colleagues from the DHSC to say a few words. So if anybody has any questions for me. I can see a question on the text box. How do we get countries to be part of this project? It's a very, very good question. We've been working very closely with raising the profile via the Fleming Fund contacts. So there's obviously a lot of paperwork to go through, and we must reach the right people. And one of the biggest questions we've had is how to find those right people as we've gone forward. Meghna, I'm not sure, do you want to jump in on this bit here as the partnerships lead?
Yes. How do we get countries to be a part of this project? And this is from Masia Bata. As Sam mentioned, it's really making connections. Masia Bata, you're very welcome to reach out to myself and Sam. We can do a little bit of scoping in country, find out who would be your director of pharmacist or the key contacts within the Ministry of Health who might be interested in the work, and we are happy to liaise with them, talk further, share about the project, and see if there are country guidelines that you would be interested in putting onto the platform. So the first step would be, please reach out to us. Our email is on the last slide, and we can put that in the chat box as well. And then we can connect and take it from there. But it really is about making the connections with the key stakeholders that we can get an approval from to put the guidelines onto the app and use further.
Thanks very much, Meghna. I think I see a hand up from Raymond.
Thanks, Sam. Basically, Meghna has just answered my question just in her last couple of statements in terms of just the need to engage with the key stakeholders. I see that there's some questions just in the chat box which relate a little bit to that, and if I can, yeah, there's one from Josephine, which is really around what I was going to also ask was, you know, for each of those countries which are already using the app, is there any restrictions or any weak areas that we know of? And I suppose my question followed from that is, you know, where there are countries using the app, you know, and they don't have maybe the connections with their Department of Health, and if they don't have the support of the Department of Health, how do you, and I know that the app champions will be obviously part of this, but whenever you've got some, you know, very large countries, you know, dispersing of information across large areas and getting other people to use information in one part of a country as opposed to another can be difficult. How are you managing to do that? Thanks.
Thanks, Raymond. It's a very relevant question to be asking, because, as you say, some of the countries that we're working with are extremely large countries. So there is some questions, often at quite high level, at ministry level, about the national treatment guidelines. Is it still one size fits all? So there is that debate going on as well. Do we put out a national treatment guideline that's been approved? Is it as appropriate in one part of the country as into another part of the country? And that leads us nicely into the customizability of the app. And we're beginning discussions with a number of our countries already about uploading more localized treatment guidelines, indeed down to individual hospital treatment guidelines that have been approved at ministerial level for using within a particular organization. So that is a really big step of acknowledging the challenges of AMR within an individual country, that the country itself geographically is just so large that of course there's going to be patches of difference between them. In terms of actually managing to get that communication across the country and making sure that we're reaching the right people, the CPA, as we know, has got a very wide reach, of wide footprint. We have a lot of friends and colleagues across the globe, and we work quite closely with national pharmaceutical associations and other regulatory bodies within each of the countries. So we start with a wider approach and then try and focus our contacts down until we reach the right person to give us the permissions that we are looking for. I hope that goes a little bit of the way towards moving things forward there. I've just noticed a comment from Samuel. Professor Samuel, lovely to see you here. I'm delighted you're here. Thank you very much for your comments about the standard treatment guidelines in Nigeria. I'm just going to say a massive congratulations, because I know that you have just published your up-to-date ones last Friday, and it is not a light tome. It is a very lengthy tome, and we're really pleased that the work's been done, and congratulations to you all, because I know it's been a real labor of love. That's going to take some time for us to get up onto the platform for sharing, but we will be working towards that. So yes, duly noted. We will make sure that your guidelines, your up-to-date guidelines, are up there.
Thank you so much. God bless you. Wonderful work that you have been doing.
Thank you, Prof. Samuel. Thank you, Prof. Samuel. Okay, is there anybody else with questions for us at this point? And if not, I'm going to ask, we've got colleagues from the DHSC, Holly and Becca. If you'd like to join us and say a few words, we'd be very grateful.
Thanks very much. Hi, everyone. I hope you can hear me okay.
Yes, certainly.
Great, thank you. I'm going to speak on behalf of both myself and Becca Becca Ketteringham in the team sort of leads on this grant within DHSC, but I just wanted to take a couple of minutes to really just thank CPA and all those involved in delivering the SPARC grant and this app. I think we're really delighted with the progress that's been made and excited that the app is now launched to support appropriate antimicrobial prescribing in human and animal health. So I think that's been great to see. It's worth just kind of noting for others on the line that this grant is part of the wider Fleming Fund programme, which is a UK-funded programme supporting over 20 countries across Africa and Asia to tackle antimicrobial resistance. We invest in really strengthening national surveillance systems through a portfolio of grants, but also global projects. And we focus on low and middle-income countries because they bear the heaviest consequences of the spread of drug-resistant infections, as has been seen in the data that's recently been published by Graham, which we also have supported and funded. And I would just recommend taking a look at that visualization tool if you haven't done already. That's on the Fleming Fund website, but really interesting to see and does show that added burden in low and middle income countries. By strengthening surveillance systems, we're really supporting countries to generate, analyze, and increasingly to actually use data to change policy and practice and address the devastating impacts and consequences of AMR. So we're really pleased that this new prescribing app will support the promotion of the rational use of antibiotics, which will contribute to reducing the prevalence of AMR and its associated burden on the countries where the app is launched. I think that's really positive, and really looking forward to seeing how that all pans out. I also wanted to take the opportunity to acknowledge the support given by local governments and stakeholders, which was really essential in getting this app up and running and working effectively. So thank you very much for your support. We know how important country ownership is in ensuring our work is sustainable in the longer term. So it's great to see how involved those local governments and you've all been in that app, and making use of the local prescribing guidelines has been incredibly important. So this coordination from countries and between grants, alongside a greater focus on One Health, will be increasingly important as we move into the next phase of the Fleming Fund's work, which we're starting to do now. So thank you again to CPA and to everyone that's been involved. We're really pleased with the achievements of the SPARC grant to date, and really look forward to the app launching in more countries in the future. So thank you very much.
Thanks very much for those words, Holly. I think that's great for the team to hear as well. So congratulations to everybody who's been involved to date, getting the app up and running, and indeed for where we're up to today. I think actually, Holly, your comments brought me back to one of the questions in the chat as well from Brian Godman. Brian, Holly was talking about looking at some of the comparisons and the tools that are available, and indeed we are beginning to start thinking about how we might be able to do some of the analyses that you referred to in your question earlier on. I think yes, it would be really very, very useful to see, and I think it will come in time. It's obviously today is the launch day, so there's been a little bit of sort of beta testing going on behind the scenes, but yes, at this point we will be able to start seeing what the download rate looks like, what the interventions are that we're starting to see recorded using the intervention tool, but also to see how people within each individual country want to adapt the app moving forward as well. Will help identify some of the areas that we can build on to support if there's any areas of weakness at all. At this point, I'd just like to say a very, very big thank you to everybody who's attended, to everybody who's contributed to today's presentation. It's been an absolute joy to be working with the team. We do have a query and a request from the CPA team that we could get everybody to put their cameras on just for a minute, and we can see who's here, and to take some screenshots to see if we can get a picture of the community who've been involved. I can see everybody going live now, so there we go. Nice to see everybody's faces springing in, big smiles as well, which is great. Thank you so much to everybody. I'm just going to move my camera so you can actually see me rather than the top of my head. Any further questions in the chat box? I'm just going to do that whilst the pictures are being taken. I can see more people asking how can we be part of this. Please do reach out to us at the CPA. Our contact details will go up on the slide at the end of the photograph session. And also you can reach us through our website as well. And we would be delighted to have conversations with you further. Bree is the project manager for the app side of the program, and Max is the project manager for the PPS and CQI side of the program. You can reach out to myself, Dr. Sam Weston, Megna, Joshua von Hayden as the strategic partnerships lead. Gloria is also the essential part of our team. She is very well organized. She is our project support manager and looks after us incredibly well, keeps us all on the straight and narrow. So please do reach out to any of us. I can see that Bree is just putting up the slide with our details on now. And thank you very much to everybody for joining us today, and to those members of the team from behind the scenes as well who are also here. I can see them. To Tactum, thank you very much for joining us. I can see a couple of Tactum faces in the screen as I was scrolling through. I can see members of the trustee board, so thank you as well. Colleagues from the Fleming Fund, from DHSC, from Mott MacDonald, lots and lots of our ICCs, our in-country consultants, our app champions. Congratulations to everybody for today's work. Well done. Thank you very much, everybody, for joining us. Have a great rest of today.
Bye. Bye.
Bye-bye.
Thank you.
Thank you. Bye-bye.
Bye. 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 Thank you very much.
Thank you.
Bye.
Bye.